T. Sundaraman, Global Coordinator of the People's Health Movement, is also with us. Mr. Sundaraman, thank you so much for joining us right here on NDTV. I want to know from you, since you work actively with the People's Health Movement, keeping these migrants, keeping these people hydrated, because we are now staring at peak summer. Temperatures have started to rise. People will be thirsty, they're on the road, walking, weak, their immune system is weak, and they're hungry. At a time like this, how do you protect them? And clearly, all the plan of social distancing, erecting a tent exactly where they are, it's not really worked.
So, two or three things, and I'll also respond to the other question which you had asked, Sanjay Nagar.
Sure.
But before that, your main question. In this whole planning of the lockdown, there wasn't too much forethought on who the actual people are. If you saw the initial messaging, it was very much towards the middle class, stay at home, you can give your housemaid chutti, pay her when you give her leave. You actually did not envisage you didn't even know, for example, the agricultural or the fishermen or the tribals who have to go to the forest. There was no messaging at all about that. When it comes to migrant labor, one of their major needs is healthcare. Many of them are sick. Tuberculosis is very high in construction labor, in a lot of this temporary work. So, in fact, the healthcare system, either they have suspended services, or lack of public transport has made it difficult to access services, or like in places like UP, since you have very little staff, you have shifted them to COVID duty, and therefore services can't be continued. And finally, the problem that Sanjay Nagral was talking about, since you have not testing for mild and moderate cases in the population, they are walking around, they are seeking help, they are amongst the migrant population also, and they are spreading disease, and you pick them up only when they infect doctors who are not doing on COVID-19 duty. So this is the new phenomena that is rising. A lot of the people on healthcare staff who are being picked up are not on COVID-19 duty, but because the general outpatient is mixed up with COVID-19 cases. That also explains why you have a relatively poor positivity rate, because you have put a lot in tracking asymptomatic contacts of migrants, which is very good. But on the other hand, we have as a testing protocol, we are not offering the test to mild and moderate cases. Whereas the countries where you are comparing,
and maybe because of that, we don't know the true picture. Maybe because of that, so we are unaware of the true picture. Okay.
Plus this new danger that what is happening is your healthcare providers, you're providing safety equipment for those on COVID-19 duty.
Okay.
But all healthcare staff, since these people are health